So here, we're going to enter into your waiting room. You find a 30-year-old male sitting in a chair, all right, waiting for his morning appointment. He's pale and sweaty, and he appears confused when you call his name. Well, here he is. What's wrong with him? Hungover. Well, that was from last night. If you partied in karaoke last night, that's what we saw last night, right? But what's wrong here? What was that? Low blood sugar. There you go, Steve. Low blood sugar. Why? Because this patient here, what do we have? He's sitting there, he's confused. Maybe he didn't eat his breakfast this morning, like some of us, coming out from last night, right? But he comes into your clinic, all of a sudden now, your dental assistant or your hygienist is coming over to get ready to meet this patient and everything else. They start talking to him, and all of a sudden he's just staring into space and not answering you back. So one of the main things as we go through our assessment to the patient is finding out, hey, he does have a patent airway. Why? He's there, he might start saying something to you, and we at least know he's breathing and all. He's pale, cool, and clammy skin. Well, he's in a state of what? Shock, right? He has an altered mental status. Does he know his name, time, place, and possibly the date? His pulse rate is 108. Remember, if a person goes into shock and everything else, initially the pulse rate and the respiration rate are going to be elevated. He's got respirations at 12. So that's within the normal range. Although actually that breath rate should be a little bit higher, probably around 18 to 20. Blood pressure, 118/90, normal or not? That's within the normal range, right? Because usually on the diastolic, 90 to 100, they start saying, okay, maybe he's hypertensive a little bit, all right? Or borderline hypertensive. Anything greater than 100 on the diastolic, the bottom number there, now we got to worry about, hypertensive patient.